Have you ever wondered if there's a natural way to treat kidney diseases? Could the answer lie in herbal medicines? Kidney diseases are an all too common health concern, affecting millions around the globe. Traditional treatments, while effective, often come with their own set of challenges. For instance, kidney transplants can save lives, but in the year 2012 alone, nearly 40% of transplant recipients in the United States faced complications within a decade. In light of these limitations, some are turning to a more holistic approach. Herbal medicine, an ancient practice that harnesses the healing power of plants, is increasingly being explored as a potential solution. From the corn silk we often discard to the humble adzuki bean, nature's pantry could hold the key to alleviating kidney diseases. But how do these herbal remedies work, and can they truly make a difference? Let's delve deeper into the world of herbal medicine and discover how it can potentially help those with kidney diseases. Herbal medicines have been around for centuries, but what exactly are they? Well, let's delve into it. Herbal medicines, also known as phytotherapy, refer to the use of plant seeds, berries, roots, leaves, bark, or flowers for medicinal purposes. They've been used since prehistoric times, and much of our modern medicine is still derived from plants. The concept of herbal medicine is grounded in our relationship with nature. Our ancestors observed the effects of different plants on animals and then experimented on themselves. Over time, they identified which plants were beneficial, which were harmful, and which were good for specific ailments. This knowledge has been passed down generation to generation and refined and expanded through scientific research. Today, herbal medicines are used as natural remedies for a variety of health conditions, including kidney diseases. They are often seen as a complementary or alternative form of treatment to conventional medicines. Herbal medicines can be consumed in many forms such as teas, extracts, capsules, or powders. But let's remember, just because something is natural doesn't mean it can't be harmful. Herbal medicines, like any other medicines, come with their own potential benefits and risks. They can interact with other medications, leading to adverse reactions. Some herbs can be toxic if consumed in high doses. Therefore, it's crucial to consult with healthcare professionals before starting any herbal treatment. Also, the quality and safety of herbal products can vary greatly, as they are not regulated as strictly as conventional medicines. So, it's important to buy from reputable sources and follow the recommended dosage. Despite these challenges, the potential of herbal medicines in promoting health and wellness is undeniable. They offer a holistic approach to healing, emphasizing the body's natural healing power. With the right guidance and responsible use, they can be a valuable part of our healthcare toolkit. Now that we have a better understanding of what herbal medicines are, let's explore some specific herbs that could potentially help with kidney diseases. You might have overlooked corn silk, but it's more than just a byproduct of corn. This golden thread, often discarded without a second thought, holds a powerhouse of potential benefits, particularly for those managing kidney diseases. Corn silk, known scientifically as zea mays, is a natural, non-toxic and effective herbal medicine. It's been used for centuries in traditional medicine across the globe, from China to Native American tribes. And while it's not a cure-all, research suggests it can be a vital player in supporting kidney health. So, how does corn silk work its magic? It's packed with compounds like flavonoids, antioxidants, and saponins. These work together to support the kidneys, helping them function more effectively. They can aid in flushing out excess fluids and waste products, reducing inflammation, and even helping to prevent kidney stones. But how can you incorporate corn silk into your routine? Here's a simple method. Boil 60 grams of corn silk in water, then let it simmer for about 20 to 30 minutes, counted after the water boils. This concoction can be consumed daily, with noticeable benefits typically emerging after 6 months to a year of consistent use. Remember though, fresh corn silk is preferable to dry, and any sign of mold means it should be discarded immediately. As with all herbal remedies, it's crucial to be aware of potential side effects. Corn silk is generally safe, but in rare cases, it may cause an allergic reaction or interact with certain medications. Always consult your healthcare provider before starting any new treatment. And it's not just corn silk that holds potential. There are other herbal allies in the battle against kidney diseases, like reed root, imparator root, and adzuki beans, each with its unique health benefits. Corn silk is just one example of how we can harness the power of herbs for kidney health. Let's look at some others. Reed root, imparator root, and adzuki beans might not be household names, but they could be key players in kidney health. In this world of herbal remedies, let's journey into the potential benefits of these herbs for kidney diseases and how to prepare them, with a note on any potential side effects. Reed root, for instance, is known for its cooling properties, clearing away heat and purging fire in the system. It's also a thirst quencher, relieving restlessness, stopping vomiting and acting as a diuretic. Typically around 15 grams of this can be added to your daily regimen. Next up is the imparator root. This root is also known for its cooling effects, specifically in cooling blood and stopping bleeding. It's highly effective in clearing away heat and promoting diuresis. The conditions it can potentially help with range from blood heat vomiting, lung heat cough, to edema and hot stranguria. Similar to the reed root, around 15 grams of this root can be beneficial. Now let's talk about adzuki beans. Not to be confused with red adzuki beans, these beans are shaped like a kidney and are purple-red in color. They have a white, elongated navel and boast of several health benefits. They can be used to lose weight, eliminate cellulite, and they also have laxative and diuretic effects. Regular consumption of these beans can purify the blood and eliminate visceral fatigue. This makes them particularly beneficial for patients with kidney disease and heart disease. Now, when it comes to preparing these herbs, it's generally recommended to boil them in water and consume the resulting brew. But remember, the key to any successful treatment is moderation and consistency. However, it's crucial to remember that while these herbs show promise, they are not a definitive cure-all. As with any new treatment, it's always important to consult with your healthcare provider before incorporating them into your routine. These herbs show promise, but always remember to consult your healthcare provider before starting any new treatment. Real-life stories can often provide the best insight. Let's look at one such case involving kidney disease and herbal medicine. In 2002, a woman in her 60s was diagnosed with thin basement membrane disease, a condition that affects the kidneys. Along with this diagnosis, she was also grappling with proteinuria, systemic edema, and transmembranous nephrotic syndrome, all of which significantly affected her quality of life. Rather than relying solely on conventional medicine, she decided to incorporate herbal medicine into her treatment plan. She began to use corn silk, a common herbal remedy known for its beneficial effects on the kidneys. She boiled 60 grams of corn silks in water each day, simmering it for 20 to 30 minutes, and drank this concoction daily. This practice continued for 6 months to a year. In addition to corn silk, she also incorporated reed root and imparator root into her regimen. These roots are traditionally used to clear heat, produce body fluids, and act as a diuretic. She consumed 15 grams of each root daily. Lastly, she included adzuki beans in her diet. Known for their kidney-shaped appearance and beneficial effects on kidney health, these beans also serve as a diuretic and help purify the blood. Over time, the woman noticed a significant improvement in her symptoms. Her proteinuria decreased, and the edema that had been causing her discomfort began to lessen. She felt stronger and more energetic, and her overall health improved. This story is not meant to suggest that herbal medicine is a miracle cure or a substitute for conventional treatments. However, it does highlight the potential of herbal remedies as a complementary approach in managing kidney diseases. It's important to remember that each person's health journey is unique. What works for one may not work for another. But as this woman's story suggests, exploring different remedies and approaches can sometimes lead to unexpected improvements in health. This story shows that while herbal medicine might not be a cure-all, it could play a role in managing kidney diseases. We've covered a lot of ground today, so let's quickly recap what we've learned. We began by understanding the potential role of herbal medicines in treating kidney diseases. We then delved into the power of corn silk, a non-toxic and effective herbal medicine that can be boiled and consumed daily for significant periods for its health benefits. We also explored other potent herbal supplements, including reed root, known for its heat-clearing and thirst-quenching properties, and Imperator root, which is traditionally used for cooling the blood and aiding diuresis. We also discussed the benefits of adzuki beans, particularly for kidney and heart disease patients. We concluded with a real-life story illustrating the potential benefits of these natural remedies in managing kidney diseases. Remember, while herbs show promise, always consult with a healthcare provider before starting any new treatment. Thanks for tuning in, and stay healthy.